Hello, my name is Luciano Gareffi, and this is my presentation on abnormal memory loss, Alzheimer's disease, dementia, delirium, and how they affect late adulthood development. Psych 110, Human Growth and Development. Memory and aging. As we age, our memory ages with us. As people, the working memory, the ability to hold and use information temporarily, loses some of its natural capacity. This makes it a little more difficult to concentrate, to recall specific details of a recent event, or to process information at high speeds. Not all changes in memory are a decline, though. Our semantic memory, our ability to remember vocabulary and general facts, is typically well retained into our late adulthood. Our knowledge and growth of vocabulary, verbal memory, and inductive reasoning often increase during middle and late adulthood. The main difference between normal and abnormal memory loss is how much it affects someone's everyday life. Normal aging can involve occasional forgetfulness, while the person can still live independently. Abnormal memory loss can be much more severe and may interfere with things like communicating, completing familiar tasks, or remembering recent events. When these problems become significant, they may be a sign of an underlying condition. Dementia. What is dementia? Well, to start off, dementia is not one specific disease. Dementia is a general term used to describe problems with memory and other thinking abilities that interfere with daily life. There are several different types and causes of dementia. People with dementia can experience problems with memory, communication, reasoning, and completing everyday activities. Alzheimer's disease is one of the most common causes of dementia. Alzheimer's disease is a neurodegenerative, progressive brain disorder that causes problems with memory and thinking. One of the most noticeable symptoms is difficulty remembering information, especially as the condition progresses. A person may also experience changes in reasoning, communication, and their ability to complete familiar activities. Because Alzheimer's is progressive, these difficulties can be more significant over time and can eventually affect a person's independence. Alzheimer's isn't the only cause of abnormal memory loss. Other forms of dementia include vascular dementia, Lewy body dementia, alcohol abuse, and malnutrition. This is why significant memory loss shouldn't automatically be assumed to be Alzheimer's disease. Abnormal memory loss can affect many different areas of adult development. Cognitively, it can affect memory, reasoning, and communication. Socially, it can make relationships and social interactions more difficult. Emotionally, experiencing changes in abilities and independence can be challenging for both the individual and their family. It can also affect physical and everyday functioning when a person begins needing help with activities they were previously able to do independently. As the loved one declines, family members may need to take on new caregiving responsibilities, and relationships can change as the person's needs increase. Families can also experience grief as they adjust to these new changes. In advanced stages of some conditions, end of life care and decisions may become important considerations. In conclusion, abnormal memory loss can alter the experience and developmental tasks of later adulthood. Alzheimer's disease does not just affect memory, but it can affect an individual's independence, relationships, emotions, and everyday functioning. Progressive memory loss does not just affect the individual themselves, but it can affect their friends, their family, and their community. Although Alzheimer's has no current cure, it's important for us to learn about this condition and various other conditions that cause abnormal memory loss. Although we can't prevent it, understanding abnormal memory loss allows us to better understand not only the condition itself, but how it can affect the entire developmental experience of our loved ones in their late adulthood. Thank you.